Hello, I am Mario Grijalva, Director of the Tropical Disease Institute at Ohio University. I first met Jaime Costales when he was a young undergraduate student at Catholic University of Ecuador. Later, he came to Ohio University to obtain his PhD. Now, he is an integral part of the Tropical Disease Research Project, leading his own research team inside the hospitals of Ecuador. In this episode, you will be introduced to Jaime's research, and you will get a better understanding of how data management plays a key role in the fight against Chagas disease.
Testing for Chagas disease is relatively simple. It only takes a single drop of blood and a few minutes' time, if you have the right tools and the right training.
The most glaringly obvious difference would be resources, equipment, simple things like gloves, beds, privacy. There just aren't the resources that you see and expect in U.S. hospitals. Somebody had said that the lack of resources takes away the art of medicine, and you commonly hear medicine as both an art and a science, but I think it really reinforces both the science and the purpose of medicine. So your ultimate goal in medicine is to improve the quality of life for a person, to improve their health, to use whatever you have to help them. And going through different hospitals and seeing the things that they've used and done, it's really impressive how they use what they have.
And while the Tropical Disease Institute and the Ecuadorian Ministry of Health have made progress dispensing these simple tests throughout the country, the problem is more complex than merely testing for the disease. Because the symptoms of Chagas often do not present for decades, tracking this silent disease in a human population can often be more difficult than tracking it in the wild.
Through the efforts of research done by Dr. Grijalva, we have some more knowledge, but there are still several holes that we need to fill in. One of them is the number of patients that are suffering from cardiac disease due to Chagas. Chagas disease, we know that about 30% of the patients who suffer from Chagas disease are going to eventually develop some sort of cardiac damage. But there are no reports in Ecuador, there are no official numbers of how many patients are suffering from it here in this country. So it is important to get those rates. And we are studying those rates at the cardiac units of different hospitals around the country. The outcomes we hope to get is first, get a feeling for what the number of patients suffering from cardiac disease due to Chagas are in Ecuador. And we also want to create a reporting system so the Ministry of Health learns about the cases for which they do not have an incidence rate now. When you speak to the doctors, they will tell you there are cases, yes. How many? They don't keep a record, they don't keep a track.
To compound the problem, data collection in most Ecuadorian hospitals is an antiquated process. Simply reviewing and cross-referencing patient information can be a time-consuming and often overwhelming assignment. Regardless, the need to do so is recognized throughout the medical community.
I believe that Manabí has a significantly high incidence of Chagas disease in the population, mostly because it hasn't been studied much at all. The study of its pathology is grossly inadequate and is rarely done properly. I myself am a cardiologist, and from what I have been able to observe, chagastic myocardiopathy presents frequently in this environment.
From rural countryside to metropolitan hospitals, the collection of data to combat Chagas disease continues. It is not an easy battle to win. It takes time, it takes perseverance, and it takes acute attention to detail and organization. But the effect of this work can be life-changing, not only for the lives that we save, but for the lives of those involved in the saving process as well.
I think that overall I just have an appreciation for why we're doctors, why we're becoming doctors, because here the doctors work very hard for very little to make a very big difference in their life. And I think that in the U.S. sometimes the ability to practice medicine is taken for granted, and it's not seen as a privilege, it's seen as a right. I worked so hard, I've done all this, I got here myself, all of this, but at the end of the day, it's still someone's life. At the end of the day, it's still someone's health. And to have the ability to affect that is, I think, such a privilege and such an incredible privilege. So the big things I feel like I'm taking away are, one, an appreciation for all the things that I have easy access to, and an appreciation for why I'm doing medicine in the first place, which is to affect other people in a positive way.
Thank you for joining us. I hope that this series has helped to illustrate how data management plays a key role in tropical disease research in general and in the fight against Chagas disease in particular. A future series by the Tropical Disease Institute will be available soon. We'll see you then.